Let's go and see where we are not supposed to inject and what will happen if we inject there. So as I've told you, the only elevator muscle for the forehead region is the frontalis muscle. If we inject very close to the eyebrow, especially in the inner medial part of the eyebrow region, patients will feel that they are having a very heavy forehead. Similarly, if we inject in the lateral part of the eyebrow, this again will go and smoothen out or relax the frontalis muscle. This is the muscle that helps to lift. So if we relax this muscle, the eyebrow will droop. So better not to inject in this region as well. And when we are tackling the crow's feet in the corners of our eyes, it is very important we don't go very low and very deep, because there's another muscle connect from here to the angle of the mouth. These are the zygomaticus major and minor. These will lift up the angles of a mouth when we are smiling. If the BOTOX or the toxin goes into this muscle, then we will have a very crooked mouth when we are smiling. Again, when we are injecting into the masseter muscle, we need to be sure we cannot inject further anterior, because there's another important muscle called risorius that also helps with smile. So the toxin cannot go into this muscle. If it happens, your smile might be very asymmetric again. For the corner of the mouth that is jowling down or causing marionette line, we inject into the DAO muscle, as I've mentioned just now. But in case this toxin diffuses, or if we accidentally inject into another muscle called depressor labii inferioris, which pulls the lip downwards, then again your smile will be very asymmetric. Your platysma muscle again is very important in the neck. If the toxin diffuses too deep, it can even paralyze the muscles that are responsible for breathing and lead to serious consequences. And it is again important that the person who does the injections for you to be aware of the facial anatomy, because it can vary from person to person, and for them to be super aware of at what depth they are injecting at. For example, if it is the masseter muscle, it has to be injected deep into the muscle, but for the wrinkle causing muscles, it has to be quite superficial.